Hey YouTube, David here. I thought I'd show you the contents of one of my first aid kits. It says level 1, but I've added a few more bits and pieces to it to make it a different higher level, hopefully. Alright, let's start off with the most complicated thing to say, and that is the sphygmomanometer, which is a fancy word for blood pressure cuff. Now, why is a blood pressure cuff a good idea? A blood pressure cuff is a good idea because, well, obviously I can take someone's blood pressure. But if I take someone's blood pressure, I can find out whether it's increasing, decreasing, or whether it's stabilized. Now, if someone's blood pressure is decreasing, and I know that because I take their blood pressure every 10 minutes, I can see if it's going down. If their blood pressure is going down, it might indicate that they are going into shock or they are bleeding internally. There's not too much that you can do unless you're a surgeon if they're bleeding internally. But if they're going into shock, you can raise their legs above their head and let the blood flow down to their brain. That's why I always keep a little notepad there as well, so I can write down their vitals, like the blood pressure over a period of time, their pulse. If their pulse is getting fast and weak, they might be going into shock. So having a notepad to write these things down is a good idea as well. Okay, just underneath that you can see I've got 3 thermometers there. The white one is an oral thermometer. The second one is a disposable, and I've got it upside down, disposable forehead temperature checker. And the last thermometer is an anal thermometer. Haven't tried that, don't think I will, but it is, however, a very good way of taking someone's body temperature, particularly if they're unconscious. But yeah, let's just leave that one alone. Alright, it's a bit too difficult to talk about. Okay, let's just pan up and have a look. Oh, we've got a stethoscope there. You can learn all these things about blood pressure cuffs and stethoscopes on YouTube. There are books about it. You know, start teaching yourself these things. You know, anyone can learn to have some sort of proficiency. So don't think that you can't do anything. There's a lot that you can learn to do. Obviously, I have the stethoscope there to help me take the blood pressure. But, you know, if you needed to tell if someone's has a pulse or something like that, they can be quite useful as well. And, of course, many other uses. Okay, looking up, there's a great book that I'm reading at the moment. I've reread it every couple of years. Defeat into Victory by Field Marshal Slim. About the British general who was in charge with Stilwell with the Allied forces in Burma against the Japanese in World War II. Fantastic book, Defeat into Victory. Really, really good book. I highly recommend it. Okay, and there's an even greater book there, the Holy Bible. I don't need to say much about that. That's the greatest comfort of all. Okay, let's have a look up here, and you can see that we have a big abdominal Israeli bandage. Now, if someone has their intestines hanging out of their body, don't try and push them back in. Just cover them. But when you do cover them, make sure that the bandage or a towel or something like that is nice and moist. Otherwise, the intestines will dry out, and that will cause all sorts of different problems. This Israeli bandage is a special abdominal bandage, and it comes with some sort of solution to keep the intestines moist. So that's quite important to have. With bandages, I've got so many gauze pads and bandages. These things, you can see I've got a big lot there. I think they're about 50 cents or something like that to buy. That's 50 Hong Kong cents. So divide that by 7 if you're in Australia or America, and you can see how cheap they are. I usually put them in plastic bags with gauze pads, so I've sort of got a ready-made bandage that I can grab, put the gauze pads on the wound, and then put the bandages around that. To the right over here, you can see that I've got cotton wool, and I've also got cotton wool over there as well. Very good if someone is bleeding and you need to mop up the blood or try and control the bleeding, or whether you're wound cleaning or whatever it is that you need to do. Cotton wool is excellent for that, and you'd be surprised how much you go through and how quickly you go through it. Okay, let's just go back over here, and I've got some small size syringes and big size syringes. I've got the big syringes there mainly if I'm irrigating a wound with sterile saline solution. It's really good to have just a big needle to help irrigate the wound. Now this is really good stuff. I've used this on my son several times. Tube gauze. You basically, if someone's got a broken finger or a sprained finger, you put this plastic applicator over the finger, then you put the bandage over that, and then you withdraw the applicator, and it has a pretty snug fitting little bandage for your finger. Very useful in immobilizing a finger if it's been broken or badly sprained. Alright. One of the things that I really love in the first aid kit is the basic dressing pack. Now you get all sorts of things with this. It's pre-packaged. You get a small tray, cotton balls, swabs, forceps, towels, and a plastic drape, and a tray as well. They're very good wound little kits. They're all pre-packaged. You just rip them open, and they're very, very effective. Very good to use in conjunction with suturing. Okay, another very important item is hydrocortisone 1% cream. I always make sure that my first aid kits have that. It's very good for itches, insect bites, and rashes of different sorts. Hydrocortisone cream 1%. I've just got a simple antibacterial cream there, and then above that is a box of antihistamines, which are good for runny noses, teary eyes, and insect bites, according to the pictures on the top. Now you can see this is a badly organized first aid kit, but just above that I have saline solution and also eye solution. If someone's got an object in the eye, or they've gotten something into the eye, you can flush the eye. Being able to flush an eye is a very basic need in a first aid kit. Coming on down, I've got just bags and bags of antiseptic for wound cleaning. I also have the iodine for wound cleaning, diluted of course, and of course the obligatory glow sticks, chemical lights, always very important. An old favourite of every first aid kit is the triangular bandage. Strongly recommend that any first aid kit has a triangular bandage. There's so many things that you can do with them, like making slings and splints, immobilizing limbs and things like that. It's really excellent. This is really basic sort of first aid stuff. Okay, now on top of the emergency wall surgery, I had this, I'm not sure what to call it. It's some sort of like hardened crepe bandage that you can use. It molds and it's pretty tough. It's excellent for sprained legs, or it's sort of like a poor man's cast in a way. It really helps you immobilize the wound. Now I've got lots of literature like emergency war surgery. That's not so useful. That's really for someone who does have medical training. I've got the MIMS, which is like a physician's drug reference guide on every known medicine, though this is getting quite old now. And underneath that I have my favorite copy of my favorite book, which is Ditch Medicine by Hugh Coffey. I strongly recommend that if you want to know about basic emergency procedures for the layman, this is the book to get. It does everything: IV, how to suture wounds, pain control, airways, chest decompressions, a whole range of things. You can get it on Amazon or go to Scribd and get yourself a copy. It's, in my opinion, it's much better than the book Where There Is No Doctor. This is by far superior in a lot of different ways. Okay, now I've just got bits and odds and sods. I've got a belt there that I would use as a tourniquet if someone's bleeding out and I need to stop the bleeding. I've got a tourniquet there. Now, the last thing that I'll talk to you about is the rubber tubing and not the gasoline, the Vaseline. And this is quite controversial, though it has been proved. And Bear Grylls actually did this on one of his episodes. It's rehydration via the rectum. That's right, rehydrating someone through their arse. And just say you've got a patient, they're in a coma, and you need to rehydrate them. Obviously, if you can't set up an IV, you can set up this tube, place it a few inches into the anus, and then pour water, not too much, down the tube. And apparently the large intestine or the bowel reabsorbs the water back into the body. So it's like a poor man's IV. Now you can have a look on YouTube for Bear Grylls episode where he does actually insert a rubber tube into his rectum. Yes, not pleasant, and you probably don't want to be my patient. But then again, it would have to be a last resort, of course. Then over here, I've just got various slings and braces for knee joints, arms, things like that, swollen ankles, that sort of stuff. I think that's basically it. I've got a few antibiotics, and but basically this is one of my bigger first aid kits that I keep. Okay, thanks for watching. If you've got any comments, let me know. Cheers. Bye.